everyone, welcome back to our channel. I'm Dr. Amal from City Skin Clinic, and today we're going to talk about Botox and fillers for men. This video is supposed to be informational, and I'm really just going to go through some of the most common concerns and questions that we have from the male patients that we've seen over the years, and just to provide some information out there that I know that isn't usually easily accessible on the internet. And I hope that you find this useful. If you have any questions about this video or about any aspect of aesthetic treatments for men, please leave a comment below, or you can email us at info@cityskinclinic.com. If you head over to our website, our contact information is there. So before we get going, if you're new to our channel, welcome. Please don't forget to subscribe and hit the notification bell. If you are a returning visitor, welcome back. Thank you for continuing to support us. So Botox and fillers for men. So the main thing that I want to kind of get across from this video is just the most common concerns that I've noticed that our male patients have had when they come new to us, and to just share the information that I normally share with them and my doctors also share with them. We as a clinic sort of have now about 25 to 30% of our patients are male, and this is growing. And in large part, I think a lot of that, and this is the feedback that we get, is because we focus on a natural looking result, we focus on personalizing treatments. And as you continue to listen, this is going to be the heart of a lot of the alleviating the concerns that male patients have. So you may or may not know, male demand for Botox and fillers has been growing in the UK, in the US, and just generally globally. It's not obviously as common as demand from women, but it's massively growing, and so actually our 25 to 30% client base being men is not something that is that bucks that trend. It's in line with that. And the reason for this is several-fold. I think there's more information out there. I think that Botox and fillers in the past have been stigmatized. It's something that there isn't a lot of information about for anyone wanting a kind of natural looking result, but there's greater awareness that actually it's not Botox and fillers that can make people look unnatural or strange. It's actually the injection techniques, it's the kind of treatment and the protocols that are followed and the skill of the injector rather than the procedure itself. We are a clinic that's based in the City of London. The majority of our patients are in their 30s, 40s and 50s, and they are professionals, and so the experience that we have is generally treating this base of people who it's very important that the treatments are subtle, that they are effective, but at the same time they do not take away from the person's natural beauty, but just enhance and augment that. And you know, ultimately people want these treatments to look and feel better, but you also want to be able to do your work. You don't want people to stare at you, and you don't want to not be taken seriously. And so it's from that background, that experience, that I'm going to go through the issues. So regardless of Botox and fillers, when we have male patients, one of the most common things that we sort of get when people come in, they're kind of often our male patients, more often than not, they've never had any of these treatments before. They usually, and I'm generalizing, but this is from my experience, as a general rule, they'll have looked over the internet, gone through what information's available, and usually come to us because, again, our website, we don't differentiate. We use both men and female before and afters, and we're quite diverse in what we put out there in the world, and I think that kind of helps, and we're big on a personalized result, and I think that appeals to a lot of male patients. The main thing they come with is that they usually know what the problem they have or what the outcome they want, but not which treatment. And actually, I always think that's the best sort of thing to come with in mind. It's good to read about the different treatments, but actually the most important thing in a personalized treatment plan is to express what your main concern is, what your goals are, because then your doctor, it's their duty to kind of explain to you what's possible, what's not possible, and you sort of are informed from the beginning and you understand the limitations and the possibilities with the treatments. So that's one thing that we encourage, and I find that our male patients come in with that. The other thing I know is that there's so many different names for treatments, and that's something that a lot of our male patients, they kind of say, well, I think I need this, but I'm not entirely sure. But again, having that specific kind of goal and the concern articulated helps a lot. I know that one of the biggest concerns that our male patients have said that they have is they worry about looking overdone, and our female patients are the same. And male patients are concerned about feminizing their face too much. So they often worry that, you know, if you talk about someone who's got kind of extensive mid-face loss, the minute you mention actually fillers in the cheek mid-face area, their big concern is, am I then going to have kind of, you know, a chipmunk face? Am I going to look very feminine, extremely kind of contoured? And so that's something that very early on we sort of say, no, actually, it's not so much the procedure itself. With fillers, we can make a face more masculine, less masculine, more feminine. It's about where you put the product, what kind of product you use, what kind of injection technique you use. So no two treatments should be the same if they're being done on different people, because you're personalizing that result. And again, it's not just about having a set of treatments you do for male patients and female patients. Even within those groups, you are adopting and adapting each treatment to that person's individual face and their bone structure and their goals as well and concerns. So one thing that's the concern is kind of looking overdone or looking feminized, and the way that we avoid that is by working with their facial structure and their goals. So for example, if a male patient who naturally has a kind of flat, broad face, but they've lost a lot of volume in here that's causing hollows, the aim would be to improve the hollows but keeping their natural kind of face shape as it is. So we're restoring rather than changing anything. One area that our male patients kind of will want to augment is often, so we get a lot of lower face, so desire for kind of a stronger jawline, augmenting the chin. And again, the concern there is looking too angular, looking too pointed, looking too overdone. So it's that balance between wanting to enhance that area, strengthen it in some cases, but again, not looking too different, too overdone that everybody notices and you're in a meeting or you're at a pitch and you look very different and people notice that. So again, we go through and personalizing the treatment, the type of filler that you use, the amount of filler that you use, where you place it, that helps give that natural looking result, and personalizing it. The concerns that male patients have are not that different to our female patients, but it's kind of addressing it in a way that someone will understand and that sort of reassurance. And so that's one of the biggest things that we get, is looking too overdone and particularly looking more feminine because of that. And the biggest treatment where there's that concern is actually lip enhancement or lip fillers. So we do get a lot of men who want to enhance the shape and definition of their lips. They want to improve symmetry, but they really are terrified that they're going to end up with lips that are very feminine, very plump, very shapely. And there's nothing wrong with those kind of lips, but it's just a concern that they have. And so again, it's about that personalized result. If you don't want it, we're not going to create a lip shape that does not go with your face. that is not something that goes with your overall look, that's going to distract. Everything should be harmonious. You know, we do loads of male lip fillers and they look completely natural, just like our female lip fillers, because it's about taking a personalized approach. Another thing that our male patients kind of worry about with Botox, and again this is not so different from our female patients, is looking frozen, looking super sort of like a hollow wax doll. The way that we overcome that, our approach is we calculate a dose and a technique of Botox based on examining your face, your muscles, your goals, and then we bring patients later if needed to top them up, because with Botox it's better to undercorrect and do a bit more later, because you can't take away, and that's something that helps, particularly Botox around the eyes and the brows. If male patients, one thing they worry about is ending up with a brow lift but a super arched brow, and again that's something that we modify our procedure to avoid doing that. So it's being aware of these concerns. Other things that I notice some of our male patients worry about is people being able to tell whether it's the results or whether it's that they've had anything done from kind of telltale signs like bruising or swelling. And so that's again something that we discuss. Okay, if you had bruising, how can we cover this up? If you had swelling, what way can we do this? In some cases, if you've got a really important event, regardless of who you are, we will say actually postpone the treatment for after that, because if you did have swelling or bruising, you might not be able to cover it effectively. So again, it's working with the patient, and these are things that I encourage patients to ask. So if they don't ask these things, I push them, and my doctor do, towards answering them, because it's really important before you have any treatment. It's not just the moment you have that treatment, but how is it going to fit in your life the next few days, the next few months as well. And then another thing that I think is really important, and it's also for male patients I encourage them to do, is if you're going to have a treatment, one of the first things we ask is, if you have facial hair, even if you don't have, how do you normally wear your facial hair? So are you someone who never has any, in which case come clean as you normally are. If you're someone who has facial hair, it doesn't matter, even if you're getting jawline work or whatever, we always say come with facial hair that you most commonly have, because again the treatment is fixing the underlying, but it needs to also go with how you present yourself to the world. So if you have a small beard or if you have a mustache, the treatment needs to work with that as well for you. So these are little tips that I recommend that you kind of discuss with your doctor. Let them know if for any reason on the day of your consultation you look different to what you normally would, specifically facial hair, or even if it's a tan or anything like that, let your practitioner know so that they can adapt the treatment. So the idea is that in your normal life, all these treatments just look super, natural, and people will notice that you look better, but they shouldn't know why you look better. It's not because there's anything shameful about Botox and fillers, it's just the mystery of it. Even when you buy, you have your hair done or whatever, you're looking for the overall effect, right? You're not just looking for someone to just be like, oh, your hair's different, but that's it. We do these things because we want to enhance ourselves overall, rather than just one element. So yeah, to recap, the main things that we kind of get concerns from patients looking to have Botox and fillers is, one, not knowing which treatment that they want, and I always say that's no problem at all. It's better to actually say what your concern is and let your doctor advise you on what would be the best treatment for you. Number two, it's looking too overdone, and particularly looking too feminine. And that's again something that the way to counteract that is to go and get treatment with someone that is experienced in treating male faces as well, and really ultimately having a personalized approach to treatment, because no two male faces are the same unless you're identical twins, and even then there are differences. So it's someone who's experienced in treating male patients, and on top of that, someone who is experienced and has a personalized approach. The third one is how to achieve a natural result. If you're someone who normally has facial hair, being able to speak about what your normal routine is, how you normally present yourself, what you normally wear for work. So that's another important one that I hadn't mentioned. If you're someone who has headgear at work, etc., because that can affect the instructions in terms of aftercare and the suitability of treatments. So this is not a conclusive video. It's just supposed to be a little bit of an intro, because I haven't done a video for specifically for male patients seeking aesthetic treatments. I will do more videos in future about specific treatments for male patients, but this is just supposed to be a little bit of a taster. Please leave a comment below if you have any questions about treatments, aesthetic treatments for male patients. And don't forget to like this video, give it a thumbs up, and subscribe to our channel and hit the notification bell. Until next time, stay beautiful.